Professor Cui, Tonji Hospital, Tonji Medical College, Guangzhou University of Science and Technology. Here he is. He will present about something that is very important for me, CEUS evaluation in thyroid lesions. Please give us the update, because this is a controversial issue. And still in Europe, we consider only for research, but I'm sure that you will present to us some clinical results that confirm that there is a role also for this application. Please, Professor Cui.
Okay, thank you very much. Good morning and afternoon. Yeah, my name is CEUS Cui, and the topic of my presentation is CEUS in the assessment of thyroid lesions. Okay, in the 2011, the EFSUMB released the first guidelines on CEUS on non-hepatic applications, but the use of CEUS in thyroid is was not mentioned in these guidelines. And our team wrote comments on the use. The reason is that the literature lacks conclusive evidence, and the rule of CEUS in this setting is controversial. And later in 2017, the EFSUMB updated the guidelines, and the use of CEUS in thyroid lesions were mentioned, but it's written that CEUS for the characterization of thyroid nodules is an active research field, but at the present cannot be recommended for the clinical use. But in China, we have also our own guidelines. CEUS in thyroid had been recommended. So today I will introduce the use of CEUS in the thyroid. This is the thyroid nodule epidemiology. The international estimates is between 19% to 67%, and over 40 years of age is 50%. Luckily, the malignancy in all nodules is just 7%. Besides BMOD ultrasound and color Doppler ultrasound, we also need other new ultrasound techniques to improve the diagnostic accuracy, such as elastography, CEUS, ultrasound-guided biopsy, and also artificial intelligence. So each techniques may be helpful to some extent for improve the diagnostic accuracy. As indications for thyroid CEUS, the first is differential diagnosis of thyroid nodules. Second is determine the nodule or the site within the thyroid nodule for biopsy. Second is diagnose thyroid nodules when enlarged cervical lymph nodes are suspected as the metastatic of thyroid cancer. Sorry, it's the indication for the thyroid ultrasound. Yeah. How to perform CEUS for thyroid? The preparation before CEUS. First is learn about the patient's history, and then thyroid biopsy should be avoided before CEUS, because so as not to affect the diagnosis, and for exposure of the neck areas. Protocol for the thyroid CEUS. First, the patient is scanned in supine position with neck extended within a small pillow. Axial scans and longitudinal scans of the host gland. The width and the length of the lobes are measured. Then identify focal lesions, measure the main lesions, and identify the dominant one. Then evaluation of vascular radiation using color Doppler imaging of both lobes and any lesions if detected. Then switch to contrast spatial mode on the largest section of the dominant thyroid nodule, and 2.4 millimeter or sometimes 4.8 millimeter when necessary. Sonoview is rapidly injected through the peripheral vein. The patient is asked not to do a swallowing action. Then start timing and storage the dynamic process for 1 to 3 minutes and observe the boundary of the lesion, the perfusion pattern, and the enhancement pattern. If the results of a single contrast is not satisfactory, the second contrast injection can be made. Thyroid can be thoroughly scanned on CEUS mode to detect lesions that are not shown on beam mode US. Boundary of the thyroid nodules, we define the boundary is clear as above 54% of the lesion boundary is clearly visible. We define the boundary is unclear as less than 50% of the lesion boundary is clearly visible. So here show the examples. In this case, we can see the boundary clearly, but this one not. Clinical applications of CEUS in thyroid. The first is differential diagnosis of benign and malignant thyroid nodules. Second is evaluation of the treatment efficacy of thermal ablation for thyroid nodules. Third is guiding fine needle biopsy of thyroid. Types of common thyroid nodules. The benign thyroid nodules include adenoma, nodular goiter, hemangioma, and so on. And the malignant thyroid nodules include papillary carcinoma, follicular carcinoma, and undifferentiated carcinoma, medullary carcinoma, and so on. Thyroid cancer. Papillary carcinoma account for it's the most common one. It accounts for 80%, but is the lowest degree of malignancy, and the survival rate of 10 years after operation is 80%. Follicular carcinoma account for 11%, middle degree of malignancy, and the survival rate of 10 years after operation is 71%. Medullary carcinoma account for 4%, and the undifferentiated carcinoma account for 2%, but it has the highest degree of malignancy. First, I will introduce the CEUS findings of malignant nodules. Usually is centripetal or diffuse hypoenhancement. And the heterogeneous enhancement and hypoenhancement are typical features of most popular carcinoma. So here we can see some case. This is a thyroid carcinoma with 2.5 centimeter. At the beginning, we can see it's a centripetal enhancement. The enhancement is from the periphery to the center. This is a thyroid micro papillary carcinoma. It's only 0.3 centimeter, but it also is heterogeneous and hypoenhancement. This one is a little bigger, 1.3 centimeter. It shows also hetero and hypo enhancement. This one is 2 centimeter, but with unclear boundaries. It shows heterogeneous and hypo enhancement. This one is much bigger, 3.3 centimeter. And with unclear boundaries. It shows also heterogeneous and hypoenhancement. But uncommonly, sometimes the papillary carcinoma may show issue enhancement. This one, and especially in the small carcinoma. This one is only 1 centimeter. Yeah, it shows issue enhancement. And this one is 0.8 centimeter. It shows also issue enhancement. This one is 0.6 centimeter. It shows also issue enhancement. And this one is 1.3 centimeter. It shows hyper enhancement, but it's very uncommonly. Yeah. Then I will introduce the CEUS features of nodular goiter. Usually, it shows diffuse issue enhancement in most patients, hypo enhancement in few patients, and the cystic parts show no enhancement. Homogeneous enhancement in most cases, and heterogeneous enhancement in few patients. So you can see some case. This is a small nodular goiter. It shows issue enhancement. This is also a nodular goiter, but with micro calcification. The calcification shows non-enhancement, but the other parts of the lesion shows issue enhancement. This nodular goiter with secondary cystic variants. And we can see the cystic part shows non-enhancement, and the solid part shows issue enhancement. This one is also the solid part shows issue enhancement, and the cystic part shows non-enhancement. But sometimes, if the nodular goiter has the fibrosis, hyalinization, and calcification, it may show heterogeneous hypo enhancement. This one is one. This is a small nodular goiter, but with hyalinization. It showed also heterogeneous and hyper enhancement. Okay, now introduce the CEUS features of cerebral adenoma. Usually it shows diffuse hyper enhancement, homogeneous enhancement in most cases, and heterogeneous enhancement in few cases. Ring enhancement around the nodules. We see some case. This one is cerebral adenoma, and it shows hyper enhancement and homogeneous enhancement. Why it shows hyper enhancement? Because there are rich blood flows in the lesion and around the lesion. So we can see also on color Doppler ultrasound. This is a small adenoma, but we can also see the blood, the rich blood flow inside. So on the CEUS, it shows hyper enhancement and homogeneous enhancement. This one also, it has rich blood flow, so it shows homogeneous hyper enhancement. Ring enhancement is more common in benign nodules, and especially in adenomas or adenoma-like nodules. This is adenoma. At the beginning, we can see the ring enhancement, and then is homogeneous hyper enhancement. So it has a rich blood flow. We can see for adenoma, there's the peripheral surrounding blood flow, so that's why it had the ring enhancement pattern on CEUS. This is a nodular goiter, but it also has ring enhancement. So ring enhancement more often occurs in the benign lesions. But sometimes we should note that some pseudo-malignant signs. For example, if the lesion has calcification or fibrosis, these parts may show non-enhancement, and it's heterogeneous enhancement. We may mistake it as malignant lesions. The second indication is evaluation of treatment efficacy of thermal ablation for thyroid nodules. Because the completed ablated nodules show non-enhancement on CEUS. Here we can see 3 pictures. This is an adenoma. Before the ablation, it shows a hyper and homogeneous enhancement. But after the ablation, the lesion is completely ablated. It shows non-enhancement. This is a lesion with microwave ablation. And before the lesion, it has enhancement. After microwave ablation, the lesion shows totally non-enhancement. The third application is guiding fine needle biopsy for thyroid nodules. One is to detect nodules on CEUS for FNA. Second, it can show the enhancement areas of the lesion for FNA. So CEUS may improve the positive rates of FNA for thyroid nodules. For example, for this papillary carcinoma, for this lesion, we should biopsy the enhancement parts, but not the non-enhancement parts, because it may have calcification or necrosis. The limitations of CEUS in thyroid. First, the final diagnosis of a thyroid nodule with CEUS must be based on the findings on conventional ultrasound. Second, for small lesions, especially lesions smaller than 1.5 centimeter, it's difficult to provide enough useful information due to the spatial resolution and the influence of respiratory and pulse speeds. Okay, thank you very much for your attention.
Excellent, excellent presentation. Let me see if we have some questions.
Okay, thank you.
Yes, Arizona, very active today, Arizona. Congratulations. It seems that you are very interested. First question. Have you been able to identify parathyroid lesions? How are the difference from thyroid lesion on CEUS?
Sorry, I didn't have the experience of CEUS in the parathyroid lesion.
Well, in general, I can answer because I had some cases in the past. The main behavior that we saw is the peripheral centripetal enhancement more than the central from the periphery. However, there are no paradigmatic descriptions since it is a rare condition studied with CEUS.
Yeah.
Other question. This
Okay.
is a general question for everybody, but you are here, so I ask you. What are some of the negative effects of the contrast in the thyroid and human body? Have you seen any alteration on thyroid after CEUS?
No, I don't think it has negative effects for the human body. Because it injects in the peripheral vein. I think it's same with the CEUS in liver and other organs.
Yeah, totally agree. We had some side effects, but generally one and not related with thyroid. And that was the reason, because we in general don't ask for thyroid analysis and general lab analysis before injecting.
Yes.
Thank you again, CEST. Let's move on to the last speaker.